Hi, I'm Herb Riemenschneider, a urologist, and today I want to talk to you about kidney stone problems. I live in Ohio. There are roughly 11 million people in this state, and about 30% of those folks, maybe even more, in their lifetime will have an experience with kidney stone problems. The technology for dealing with kidney stone problems has really exploded, and a comment that you're probably already familiar with called minimally invasive, in other words, don't disturb the patient's well-being very much while solving their problem, is really the heart of what's going on in kidney stone disease management. Most of the time people first become aware that they're having a pain usually in the back, and it doesn't just always stay there. Sometimes it comes around to the front. And having been a kidney stone patient and knowing exactly what that feels like, I can tell you, and my patients have already told me, it's the worst pain you can feel in the world. And you know something? There's not a better way to say that. Kidney stones are basically the product of forming urine and filtering a lot of the necessary nutrients that you consume during a day to meet your needs. And some of those aren't very soluble in water, and you got it. When they collect, they turn out to be kidney stones. As those kidney stones come down through the urinary tract, it gets narrow. It goes from a broad space on top to a very narrow space below. The broad space is called the kidney pelvis. The narrow space is called the ureter, and that's where most of the problems occur. And the pain occurs not because the stone itself is causing the pain, but because it plugs up the system and then it dilates behind that area. And men have this problem about twice as often as women. Most of the time these stones are calcium compounds. Sometimes they can be made of other things such as uric acid. The difference is the calcium-based stones you usually can see on an x-ray. The uric acid stones can't be seen on x-ray. We have big terms, but basically x-ray just doesn't show it. And on occasion we'll run into stones of infection. Focus on for this moment is a stone that's stuck in the middle of the tube that drains the kidney, in the middle of the ureter. The kidney is plugged up and it hurts. Well, what do? Well, first thing you do is call your doc and tell him you have a pain in the back, and he may tell you he thinks you have a kidney stone, but probably the best thing to do is get an x-ray, which usually happens shortly after the pain develops somehow, and then what you need to do is see a urologist. But I'm going to tell you that what you really need to see is a urologist that works in an ambulatory environment, because this marvelous technology for dealing with stone disease can all be housed in a center where you can walk in, be treated, and be home while everybody else is sitting in the hospital emergency room waiting area. Well, for example, here's a stone that was stuck in the middle of the ureter. Patient presented just as I said, found his way to our place, and we put in a little instrument called a stent. Stent's a little silastic tube that we can slide up through the ureter, and what happens with it is we drain the kidney and the pain goes away. Stents sometimes can be a bit of a nuisance, but usually not a big nuisance, and not at all compared to the pain you have when the stone presents. Now, how do we take care of these stones? Well, we use instruments. They're very fine instruments. They're optical instruments. This marvelous technology is a byproduct of the space age: fiber optics, lasers, miniaturization. This instrument is a ureteroscope, very small, excellent vision, and we can, with the use of x-ray guidance, these treatments are done in a specially equipped room that has good x-ray imaging, we can enter the bladder with this scope, find the ureter, and place this very small fiber optic instrument into the ureter and go right up and see where the stone is. At this point, we have some options, but today, with laser therapy, particularly the holmium laser, we can advance that laser right up through this scope, put the laser on the stone, and literally turn the stone to dust. Now, when that's complete, we may or may not have to use a stent, but the important thing is that you collect these fragments so we can analyze them, so in the future we'll have an idea of what we can do for you to keep you from having more stone problems. You may be aware there's another technology called ESWL, or shockwave lithotripsy. We don't have to put any instruments into your body. It's totally non-invasive in that sense. And this shockwave will essentially be focused on the kidney stone and turn that kidney stone to dust, which you then can pass. As a rule, you have some mild anesthesia. You may hear a little thumping, and before you know it, your stone's broken, and it will pass down and out through the tube called the ureter. Patients have really found this to be a comfortable way to deal with a very uncomfortable problem. Occasionally, though, we see stones that get stuck in kidneys. They're too big. They don't respond to lithotripsy. And there is a technique, again with very light anesthesia, where under x-ray a needle can be introduced over the kidney through the abdominal wall, and with a little balloon you can dilate that tract, and you can put a scope in the kidney, and you can essentially put a laser on that stone in the kidney, break it up, and either remove the fragments, or once again the fragments will pass and the patient isn't discomforted very much and gets back to work in a big hurry. But the key to all this is, what can we do so you don't have another one? But let's just say a few simple things. We want you to drink a lot of water. So what is a lot of water? Well, probably 8 to 10 glasses of water a day, or so that your urine looks clear when you pass it and doesn't have a lot of coloration. What about changing your diet? Well, there are some reasons to change diets, because actually most kidney stones are calcium oxalate. And oxalate is pretty common stuff. It's in our tea, coffee, Coke, beef. It's in most of our foods. But we know which foods are high and which foods are low, and if you come to the urologist and we decide that's something you need to know, we'll tell you about it. But usually we'll do some more tests before we come to those conclusions. Sometimes we use medications. But the bottom line is this: if you have a kidney stone once, you'll know what kidney stones are. If you have a urologist who's focused on the ambulatory aspect of treatment of stone disease, you won't be nearly as inconvenienced as others have. And if you come to Riverside Urology, we'll treat you with a great deal of care, and I think we can make a big problem almost a non-problem. Thanks for listening.